You shouldn't be waking up in the middle of the night too many times with tingling hands. You may have carpal tunnel syndrome if that's happening. Well, carpal tunnel syndrome is not entirely very uncommon. Unfortunately, it happens more in ladies because the ladies have a narrower tunnel in the wrist. So here we're talking about a tunnel. So definitely there is a tunnel in the wrist which allows the passage of multiple structures. There's about 9 tendons which goes up to your fingers and 1 solitary nerve which supplies the 3 fingers over here. Of course, it's a crowded place. Now, as we grow older, because of wear and tear, most of the time without any reason, this particular space becomes tighter than before. So you can imagine that the pressures go up. What happens next is movements like this or like this, or prolonged positioning in this position or this position causes an increase in pressure which actually presses on the nerve and ends up in a hand which starts to tingle. Why does it happen when we are sleeping? Because when we are sleeping, we don't exactly have much control over our hands. And the most common way we all sleep is like this. So imagine the wrist being bent like this for too long and you have carpal tunnel syndrome. The pressure is going to go up. Tendons and the space is going to be pressing on the nerve and the nerve starts crying out, and the way it cries out is by causing a tingling sensation in your hand. Now, most people who actually start having the symptoms of carpal tunnel syndrome will actually start off with tingling. Now, if you ignore that, that actually turns into numbness, and this numbness might be intermittent, meaning that it comes and goes whenever you're actually working, like for example, when you're driving, or when you're on the phone, or when you're typing, or any sort of like actions which involves prolonged positioning of your wrist in an extended or a flexed posture. So, how do you identify it? If you're having this tingling in these 3 fingers, it is possibly because of a compression of the nerve in the wrist. If this is waking you up from sleep very often, that's another indication. And if your hands are getting numb whenever you're holding your hand in flexed or extended posture, that is also another indication. Now, when you go to the doctor, it usually is a hand doctor who's going to be examining your hands to identify if you really have carpal tunnel syndrome or not. They might ask you to do a few simple tests, but they are simple enough to detect if you have carpal tunnel syndrome or not. So the doctor might ask you to hold your hands like this for about 1 minute. Or he might ask you to hold it the other way around for 1 minute. Both these actions are actually keeping your hand extended or flexed for a little bit of a time, which can actually trigger the numbness or the tingling itself. The other thing what the doctor usually does in the clinic is tap around the carpal tunnel, or the tunnel which is around in the wrist. And if you feel that there's electric current-like or numbing sensation running to your fingers, that is also an indication that you might have carpal tunnel syndrome. What tests can we do? We usually suggest a nerve conduction study. Now, the nerve conduction study gives us an idea about which nerve is affected and where is the compression. Once we have a diagnosis, we usually consider straight away to move to a sort of treatment. Now, we know the problem whenever your hand goes in an extended or a flexed posture, the numbness starts. So why don't we give you a soft brace? Not a very soft one, but fairly rigid brace, which you can wear every day at night when you go to sleep. That's going to ensure that your wrist doesn't go into flexion or extension, stopping the compression of the nerve. Along with that, we usually give you some vitamin B complex, though it's not exactly proven. Anecdotally and through experience, we have noted that it does help the patients. We can also give you some anti-inflammatory medications because sometimes inflammation in the wrist itself can cause the compression. If that doesn't work, we can always suggest giving a steroid injection around the carpal tunnel itself, which itself can actually reduce the inflammation. If we are planning to give an injection, we need to do it under ultrasound guidance. Imagine both of these things don't work. We don't have much of any options left. It's time for surgery. Surgery is fairly simple. We can do it under local anesthesia. It actually involves making an incision just around here, going down to the roof of the carpal tunnel and releasing that roof. Once that is done, most of the times your symptoms get better. For carpal tunnel, as it involves the nerves are a bit of a different quality of things. If you had been having this problem for a very long time, do not expect the symptoms to be getting better immediately after surgery. your numbness might take quite a long time before it actually disappears entirely. In severe cases, the numbness does get better, but does not disappear 100%. Now, some people might ask, are there any options of minimally invasive surgery? There is. We can do it endoscopically. Now, once we do surgery, there are some things we need to tell you about how to take care of your hand. First of all, we need to start moving your fingers as early as possible and also your wrists, so surgery does not stop you from moving your hand. Your wound takes about a week or so to get better, so we really need to make sure that your dressings do not get soaked or dirty. Now, the most important thing what I usually tell our patients is the first month after surgery, you're not supposed to do any very heavy carrying, heavy lifting or any heavy work. Because if you do that, sometimes these two parts of the hand might become very painful. So that's going to be our most important word of caution. Carpal tunnel syndrome is not very uncommon. It is prevalent in the normal population. So if you're feeling that your hands don't feel normal or your sensation is not normal, there is a possibility that you might have carpal tunnel syndrome. Don't ignore it. Please find your nearest hand doctor and get it treated, because we have definitely very good treatment options.